Have you looked into, I don't know if the American Parents Coalition, by the way, Alleigh Marre, by the way, is the executive director, rather, of that organization. I'll get all your information up. What I was wondering, have you looked into the medical coding industry, which is controlled by the American Medical Association? You know, they're the ones that come out with the code book of what all these different medical procedures are coded by and how it can change so quickly. And I'm just going to give you a personal example of mine. I don't know if you can concur with this or not. But a few years ago, I had a colonoscopy. It's not something I like talking about during breakfast time, okay? But the point being is that I was told that this colonoscopy was just a nice screening. It wasn't going to be anything. It wasn't going to cost other than a minor copay, that sort of thing. But what ended up happening is that, oh, we found a precancerous lesion. It's perfectly okay. So they snipped that, and the free screening then turned into an $1,800 bill after the fact. And that kind of reminded
Right.
me of what you're speaking about. It's like, you know, I'm at this point like, okay, what's this really going to cost? They said, well, it's going to be a free screening. Well, if they find something and all of a sudden it's a different code. Have you heard about that racket, the way it's being worked these days?
Oh, absolutely. I mean, we've talked about it a lot through the lens of with moms with childbirth. I have 4 kids myself, and every single one of those births have gone very differently. So you may enter the hospital walking in thinking, okay, this is just going to be your quote traditional labor in and
Hmm.
out in 48, 36 hours. And then there's an issue either with you or your baby, or you're in the NICU, or you do or don't want vaccines, or this or that treatment. Are you bringing in the pediatrician? Do you have your own? There are all sorts of variables where if you had the pricing up front, you could compare that from system to system and say, like, okay, I know I only want these services, but let's say if it does escalate at hospital system A, where does that put my pricing? At hospital system B, where does that put my pricing?
Right.
And then you also would have an opportunity to look at the doctors side by side and say, okay, am I willing to pay a little bit more because I look at this person's resume and their experience and, okay, that's worth it to me? Or am I pretty confident that, you know, person Y can handle this if it gets, like when people are empowered with information, with prices, with an understanding of their doctors and the procedure pipeline, like what could happen, we are much more empowered to make better healthcare decisions for ourselves, for our families, and that in the end results in better outcomes.
You know,
And that's
Allie,
really the most important thing.
certainly, Allie, to your point there, that it makes sense that, okay, the hospital could say, here is the price for a no complication labor, right? And a birth at the hospital. Fine. Yeah, we get that. I also think we would understand that if there were complications and big problems, that naturally it wouldn't be the same rate. We all understand that. I think
Yeah.
people get that. Sure. All right. What does it take, though, to make this happen, to actually put it in law?
Well, we we need some sort of legislative action coming out of the Senate, which is tough right now. There's a lot on their plate, especially with
Well, the same group that can't get TSA paid right now, right?
exactly. That's
Uh-huh.
that's where I was going. We've got that, of course, on their list first. But we're going to continue to bang the drum and make some noise and hope that we can get some sort of healthcare legislation through the Senate, and that it would include healthcare price transparency, because we really believe it would have a huge effect, not only just on parents from a pocketbook perspective, but also on health outcomes for families and kids.
How can we help you at the American Parents Coalition do this?
So we have a lot of resources on our website, AmericanParentsCoalition.org, where we have like sample letters where if you want to send something to one of your representatives, if you want to make a comment on one of these rules that's moving through the administration right now, or an executive order. So we have a bunch of different ways that you can get involved on our website, AmericanParentsCoalition.org. And then just to loop back to what you said up at the top, if there's any broader things affecting your family, parental controls on social media, if you're having any of this funky gender stuff going on in school, we have a lot of resources for that as well on our website.
That's very good. Hey, Allie, I think we may have someone with a comment or a question for you. Hi, good morning, caller. You're with Alleigh Marre. Good morning.
Good morning. This is Vicki from the Applegate.
Yeah, Vicki, you wanted to weigh in on this medical transparency issue that she's discussing.
Yeah, actually, I had a similar experience like you did with your colonoscopy.
Mm-hmm.
My son had a seizure, and we took him into the hospital, and He was in there not even quite one day, and the seizure was caused by a certain reason, but they wanted to do a meningitis test on him, and it's like,
okay, yeah.
No, this has nothing to do with his issue that he's having right now.
So the bottom line, what ended up happening during this process? What ended up happening during this? We can't do the whole story, but
Well, he ended up being all right, but the point was that they wanted to run tests on him that had nothing to do with why he was in there. And even though we don't have, he's an adult, and even though he obviously was incapacitated, he couldn't make any health decisions for himself. And as his parents, he's lived with us all his life. He was a preemie. And so we've dealt with many, issues, health issues for him. And the doctors were just like, well, we want to give him a meningitis test. And it's like, what? Wait a minute.
Well, I could see why maybe a doctor would if you had a seizure, but I guess now, did they give you pricing? This is the issue we're talking about. Did you know what anything would cost before it happened?
He's actually on the Oregon Health Plan, so his medical is covered, and then he's also eligible through a lot of the doctors' offices now. They do give you financial aid, and if you're not able to pay, but the point being is, they want to do things that are not even associated really with why you went in there for treatment.
Okay, well, let me talk with Alleigh about that. Alleigh, is that something that you're focusing on, or is this just kind of a side benefit, if you want to call it that, of the lack of transparency in medical care?
I think they can. I think they all kind of work together. This may be a little bit closer to what you had brought up earlier about, like the billing and the coding.
Yeah.
Especially if you're on a state or group sponsored plan like that, where they may be able to then bill out to the system, not necessarily even to the patient. It's like, well, it benefits us to run these unrelated tests because then we can charge for them.
But then there's also the doctor's liability side of it, too, in which they'll say, well, the guy had a seizure, why didn't you test, right?
Exactly.
You can see that coming. Yeah. All right. Between liability, between the insurance rackets, between the AMA rackets, boy, there's a lot of rackets, battling for our attention in this kind of legal system here, Alleigh. But I'll tell you what, I will put your information up there and see if we can put a little love on your issue and get Congress to get off the stick, so to speak, okay? And make this happen. And once again, this is AmericanParentsCoalition.org. You got that right? Correct?
That's right, yep.
All right. Alleigh, a pleasure talking with you this morning. Thanks for being there.
Thanks for having me.
6:53. This is KMED and 99.3.